We are so happy to have Dr. Mickey Karram with us tonight. Dr. Karram is an internationally renowned urogynecologist and pelvic surgeon. He is Director of Urogynecology at the Christ Hospital and Professor of Obstetrics, Gynecology, and Urology at the University of Cincinnati School of Medicine. Today he will be talking about a significant new treatment, the MonaLisa Touch laser, for symptoms of genitourinary syndrome of menopause, previously referred to as vulvovaginal atrophy.
Menopause symptoms and conditions are obviously very prevalent. A woman naturally goes through menopause at an average age of 51, and as that occurs, you're all well aware that there's a loss of the natural estrogen, and that impacts the body in a lot of different ways. One of the areas that it impacts that I think is not really talked about a lot is the pelvic floor, and specifically the vaginal skin and the vulvar skin. Some recent surveys and studies have shown that on average, by the time a woman is 3 to 4 years postmenopausal, that up to 40 to 50% of these patients will suffer from these various symptoms. And obviously this can have a huge impact on a woman's quality of life. If we look at the demographics of our population in this country, the largest segment of our population growth-wise is the female above the age of 60. And so this is a huge therapeutic area. Another big component of this are patients who develop breast cancer. Obviously, breast cancer survivors very commonly cannot take any estrogen supplementation, and many times they're placed on therapies that actually antagonize the estrogen that's in their body. So this is, again, a very large segment of our female population that continues to suffer in silence from these various symptoms. Approximately 250,000 women every year in the United States are diagnosed with breast cancer. The good news is the 5-year survival is almost 90%. The bad news is these patients really, up until recently, have not had any options to treat these local symptoms. Currently available treatments for this very common condition are obviously estrogen supplementation. The challenges with local therapy are many. One is there's always an issue of compliance. It's difficult to get a woman to stay on a cream or a tablet on a regular basis. So they're tedious, they're messy, and unfortunately they're very expensive and many times not covered by insurance. And then finally, there's always the concerns regarding the safety issues with estrogen. And then finally, most women are left with basically a variety of moisturizers and lubricants that are over the counter, and they sort of do do the best they can to get by on a daily basis with this. So I think it's important to understand how I got involved with this therapy, and it was really serendipity. During my tenure as editor-in-chief of the International Urogyne Journal, I got to know a lot of the international urogyne community, and one of the individuals that I've remained in close contact with is a urogynecologist in Milan, Italy, named Dr. Stefano Salvatore. And probably a year and a half or 15 months ago, I got a call from Dr. Salvatore, and he wanted to make me aware of a new therapy that they've been testing and treating patients that involved the use of a fractional CO2 laser for women with symptoms of vaginal atrophy or genitourinary syndrome of menopause. He said it was pretty remarkable in regards to how well it worked, how simple it was to deliver the therapy. I was very skeptical because the whole concept of lasers and in the vagina really has not had any real credibility in the United States. Most of that is based on the laser vaginal rejuvenation that was promoted, I think, very inappropriately, but you need to understand that that's a whole different concept. That was actually using a CO2 laser or some other kind of laser to actually cut tissue and tighten things, etc., basically altering anatomy. And what Dr. Salvatore was doing was basically laser or light therapy directly to the skin of the vagina and the vulva. I reached out to a colleague of mine, Dr. Eric Sokol, who's a urogynecologist at Stanford, and we both agreed to go over and visit Dr. Salvatore in Milan. So we both came back to the U.S. and agreed to do a small study, and we've each done 15 patients under protocol. That study is done, and we've now got 3-month follow-up. And our data is almost in direct agreement to the data out of Italy. We've been very impressed with the results we've seen for treating these very common symptoms. So I think it's very interesting to understand the pathophysiology of what actually occurs in the vaginal and vulvar skin when a woman with symptoms and the condition of genitourinary syndrome of menopause is treated with this fractional CO2 laser. Basically, what DECA, the makers and the originators of the laser, have come up with is a mechanism to deliver laser therapy very superficially, ablating the epithelium and doing that in a very simplistic fashion, not causing any pain, not causing any abrasion, but at the same time having the ability to have the dot penetration of the CO2 laser through the epithelium and actually impacting the deeper layers in the ground matrix. And it's pretty remarkable in that in our study we had to see patients 1 week after the first therapy. And inevitably, almost all the patients immediately, within 7 days, noticed increased lubrication. The vagina becomes more pliable. They were able, many of them were not able to have any type of sexual intercourse prior to this, and almost all of them that weren't able to or were having pain with it noticed almost an immediate improvement the first time they tried afterwards. As with any new therapy, obviously there always has to be some scientific validation of it, and I think it's important to appreciate that this therapy is and continues to be studied. There's probably about 5 peer-reviewed publications now out of Italy. The therapy has been administered to over 5,000 women worldwide, about 2,000 in Italy. The various peer-reviewed publications have been mostly in menopause journals. There's recently a new publication that actually looks at the histologic changes we alluded to earlier. Dr. Sokol and I are in the process of putting our data together for a submission to a peer-reviewed journal. Of interest, the Italians have also done some histologic studies, and I think we have a few slides of those. And again, it's remarkable how you see actual histologic changes, and you see an epithelium that is very characteristic of atrophy, with a very thin epithelium, a very poorly vascularized lamina propria and ground matrix. And with just one therapy, you see significant alterations with thickening of the epithelium, hyperkeratinization, much better and healthier ground matrix. So the protocol that the Italians have used and we subsequently have used as well is one of 3 treatments done 6 weeks apart. And as I said, we almost inevitably saw a an immediate response after the first treatment, but there is definitely an additive effect that's very positive after the second treatment and then after the third treatment. My experience with the MonaLisa Touch therapy, as I mentioned, has been the protocol that we did, or the study of 15 patients, and all those patients were treated 3 different times. And now, since we completed that study, I've now treated probably in the range of 20 or 25 women off protocol. To date, I've not had any issues with pain. We've not had any problems inserting the probe and actually delivering the laser therapy. And again, many of these patients are very dry and their vaginas are somewhat on the tight side because they're very atrophic. This animation sort of demonstrates the actual mechanism of how the laser therapy is delivered. You can see that the probe is inserted to the top of the vagina. You need to get a rough estimate about how long the vagina is, and the therapy is delivered at 1 centimeter intervals as the probe is withdrawn through the vagina. Of note, you end up only treating about 10% of the surface area of the vagina, but the effect is on 100% because you do get this sort of thermal spread. But again, the entire therapy takes in the range of 5 minutes at most, and to date we've not had to provide any type of anesthetic or analgesia post-op. Patients obviously walk in and walk out of the office without any issues. One of the other things that's very, I think, impressive about this therapy is that there's really no post-treatment restrictions. Short of probably avoiding intercourse for a day or two, patients can otherwise do whatever they want, literally immediately after the therapy. As I said, it was a very rare event that any women had any feelings of sensitivity or pain after the therapy. It was impressive that we talked to a lot of the patients, and many of them were more than willing to give testimonials. It was very impressive to hear them, in their own words, state sort of how this has impacted their life. And one of the women that was in our study, Patty, is going to talk a little bit about that right now.
I was having a lot of pain with intercourse to the point where I just stopped being sexually active. Okay. And I was hopeful that it would correct the problem, and it definitely corrected the problem. I had been trying to be sexually active for a couple of months prior to the first treatment with no success, way too much pain. I tried multiple things. I did the patch, I did creams, I did oral medication. But in all honesty, I didn't stick with it long enough to see if it would have any impact. There's no pain, no discomfort. It's really, there's nothing to it. And I definitely saw results pretty much immediately. Okay. And continued to see even better results. Well, the improved intimacy definitely impacts a lot of aspects of my life. I'm happier. He's happier. Yeah, it's had a big improvement. My message will be definitely try the MonaLisa. It's worked for me, and I'm very, very happy with the results.
So to sort of summarize, the MonaLisa Touch therapy has been an extremely well-received addition in our practice and at the Christ Hospital. The therapy is not only being delivered by myself now, is being delivered by a variety of other gynecologists. Our breast cancer surgeons and medical oncologists are now well aware of the therapy and are routinely referring patients that are good candidates for this. So it's been a very nice addition to the armamentarium of various therapies that we offer patients.